A warm welcome to this Health and Performance Booster series powered by Hintsa Performance and Hirslanden Check-up Center. In this series, we really aim to improve and help improve your health and performance, of course, and to reach measurable results. Because after all, what really is important for performance and reaching peak performance is, of course, health and well-being altogether. My name is Dr. Anna Erat. I'm from Hirslanden Check-up Center, and today I have two experts from Hirslanden and Hintsa Performance with me, Dr. Andreas Miller and Dr. Eric Garcia. A warm welcome. So, Dr. Miller, Andreas, what's your connection and interest in general health as a gastroenterologist? Who are you? Do you want to explain a little bit about your background?
Yes, I have already quite a long life behind me. And of course, I'm in prevention medicine as a gastroenterologist involved. I'm hoping to reduce the colon cancer. Therefore, I'm very much interested in to reduce the cancer. So I studied as well all the little things about the GI tract, and that's very interesting. And you don't have to stay with only the colon. You have to see at all different sides of health. And there are several very important points. And I see always patients who come with at the age of 50 to do a screening of the colon. But I look at them and I see they have different issues. So it's very important that every human being should know what to do for the health. It's like an investment, not only in long life, but quality of life. That's very important.
So what we always say is health is wealth.
That's a very good point.
Yeah. And Dr. Eric Gerstel. Eric, please, would you like to introduce yourself?
Yes, hello.
Hello.
So I'm in Geneva now, and I've been working for Hirslanden for the last 10 years. I've been very much involved in prevention since I opened the checkup units more than 8 years ago. And at the same time, I've been working with Hintsa, in particular with Hintsa, and helping sportsmen and also patients to improve their health following the program.
Thank you very much indeed. So if we start moving a little bit to the first topic, particularly in direction physical activity, which is of course very much on demand at the moment after a lockdown and people being in home office for months and months in a row. What is the impact of physical activity on general health, Andreas?
That's very interesting. I thought always it's good for bones and muscles, but it is good for the whole body. I didn't know until recently that 10% of all colon cancers could be prevented by physical activity. And that doesn't mean that you have to do a training every day for 2-3 hours. 30 minutes of activity is good enough for preventing 10% of the risk for developing a colon cancer. And that's only a part, of course, all the different organs, heart and so on, I cannot go into details.
Of course, but how do you define physical activity? So 30 minutes of physical activity, what does that mean?
30 minutes, it's not that you have to do a marathon. If you are sweeping the boardwalk for 30 minutes, it's good enough.
Or taking the stairs rather than the elevator.
Exactly. The heart rate for the older people doesn't have to be 100. That's not healthy.
Right.
But you have to be physical active, and this is a little the problem as you get older and lazier.
Sure. I mean, we see that nowadays, right during this corona pandemic. A lot of people, particularly in home office, they don't take the train to work, they don't take the stairs to the fourth floor to their office. And so these small changes on a daily basis really lead to, of course, weight gain and something that we call corona fat, I mean, which is not so flattering, but that's what it is. And so we see that. From your point of view, Eric, you're an internist. What can you say about the impact of physical activity on general well-being?
I might start answering the question with an example. A few years ago, I conducted a study among home care nurses who used to visit the patient at home, and they were having different way of transportation. They were using the car, Some of them were walking, other were using public transportation. And we started educating them to go either by bike or by foot only, and to improve slightly their behavior in terms of their health. Despite they are already in the healthcare system and well educated, just the small advice we gave to them make big changes. The impact on the cholesterol and on the blood pressure was higher than just giving a medication. Most of the home care nurses improved their health drastically with very small changes. So I can tell you, I have observed many times, small changes make big difference in you if it's in terms of physical activity.
So baby steps are quite important, or small
Very
steps
important.
to really reach huge or larger goals.
Yeah, there's been also this very nice study showing that if you exercise a few minutes per day intensively and you contract your muscle quickly, you might be as fit and in as good health as people working with their physical activity for more than 1 hour per day. So it's just a question of starting doing it, not the question of the time.
Absolutely. I mean, I remember as an internist myself in the hospital, I must have had at least 18,000 steps a day just running back and forth between various wards. And nowadays I don't do that anymore. So I really have to put an extra effort into getting enough exercise, which is a little bit of a pity. So that was a really nice byproduct of being a junior doctor. But there are other benefits nowadays, I have to admit. And then when we talk about fat and weight gain, obviously a very logical step is to talk about diet. And furthermore, also the microbiome. Diet, what does diet have to do with health? I mean, we know some things as of many, many years, but there are also a lot of new data on diet and health.
Exactly, but you talk to a gastroenterologist, they know very little about diet, but my personal experience, I've been a long time on diets because I had to take cortisone as I was young. So to make it short, I could now give a talk for 2-3 hours, but to make it short, eat plants. That's important. That's in a short sentence, it's said that's healthy. And you look at the data. The people with Mediterranean meals are the most healthy ones, and they live the longest. We don't know if this is biased by they have a different art of living, they are relaxed, perhaps they get less heart attacks, but if you go through literature, it's certainly that more plants are healthy, lots of fiber, but the thing is with fiber, you should eat a lot of fiber, and our stomach is not made anymore for this. So we are not used to it. So it's difficult, and we have to adjust this to the Western civilization with not much starch, and that would be important to eat. Mm-hmm. And then, of course, you mentioned the microbiome. Give me 3 hours. No, I studied this since about 6-7 years because my dear wife told me, study this, and I studied, and I was amazed.
Well done.
Yeah, thank you. I was amazed that the microbiome has a very important point on our health. What is the microbiome? There are a lot of bugs. And these bugs, they are living mainly in the small intestine, as well in the colon, but at different sites in the body. They consist of bacteria, parasites, mushrooms, and they are healthy. And they are defined by the DNA as you are born. And as soon as you get the first milk from your mother, or you get the environment involved, then it changes. Mm-hmm. And to summarize this, it's good to have a very big diversity of these bugs, bacteria, and so on. If you don't have this, then it's not so good for the immunity, because these bugs are in the small intestine and are responsible for our immune system. And they are responsible for the intake of vitamin B, for example. Without them, you can not live. You have this, they are healthy. And as soon as these bugs are disturbed, for example, if you have a gastroenteritis, then your immune system is suffering. And you can, of course, alter this microbiome. That's another 2 hours to talk. But to make the thing short, again, you can eat differently by food. So these are the This is called the prebiotics. For example, the bananas, as an example. Or you can eat tablets, and in these tablets there are bacteria and so on that can change again the microbiome to the good. And this is now a big issue because we spend billions of francs, dollars in this, but we don't know what we do. We are now doing a lot of research, and I believe it takes another 5-10 years until we know what if it helps. Sure. But if you look at some specific information, for example, Clostridium difficile infection, where we have no chance with antibiotics sometimes, you give this person a transplant of stool, and then with bacteria, with the right ones, and the patient has healed. Yes. Then we go even further in the future, and then we see if you swallow or you get these little tablets or endoscopically, you have the stool from a young man that changes the microbiome, and it makes the older younger. How can I prove this? You can not only look at this person, but you can measure with the telomere, you can measure how long they are, and as longer as they are, as longer you will live. So really exciting. But we have, in 2020, we have had 10 times as much information as all the years before, the data. So we are all getting crazy. It's an explosion.
Sure.
And this is a short summary, and I hope the expert, the internist, will correct me if I have said not everything already in this small.
I'm very curious what Eric can tell us, because it's really a boom. I mean, the microbiome is, you read about it everywhere, even in research regarding degeneration, mental health, Alzheimer's disease, dementia. Even there, it seems like the microbiome has an impact. So I'm really curious, Eric, to hear about you and your experience. Have you had any experience with fecal transplants or probiotica that you've given to your patients in order to boost their immune system and boost their gastrointestinal digestion?
I have some experience. A few years ago, I was treated a patient a young patient was dying from colitis, and there was no other option than doing a transplantation to save her. And so I convinced her husband to give some stools, and we did in the emergency a transplantation, a fecal transplantation. And I was surprised and shocked how quickly the patient improved. In just a question of hours, she completely recovered with a very small amount of stool that we had to give. So it showed me that we are just at the beginning of understanding something just amazing. And I just can't explain how it works, but it worked so well, and we saved her life. So that's one experience. And I had other experience with the transplantation as well. And it's amazing. It's the beginning, and we have to just say that we don't know much. Sure. And there's so many people, showing that they know how to proceed, how to adapt the microbiome. We must be very honest and say we still don't know much, but that's the future for sure.
Yeah. Well, we need to gather data. We need to gather evidence. Like always in medicine, that's how it is. That's how we work. Yeah. And unfortunately or fortunately, we have to sometimes experiment a little bit within limits, of course, in order to understand how the body reacts, how an individual reacts. Just like you said, Eric, with this patient of yours, this woman whose life you actually saved through a tiny fecal transplant. So this is how medicine, of course, works. And the same also goes for diets. Some diets are very personal. Some people tolerate starch and carbohydrates very well, or milk products very well, and other people do not tolerate milk products or various glutens and so forth. So we also have to individualize and look at every individual differently and cater accordingly. Eric, what could you say about diet, though? We already talked a little bit about the Mediterranean diet, and there is really evidence, also a new study that shows that for long-term weight loss, the Mediterranean diet is for long-term, so over 6 years. The Mediterranean diet is the best for losing weight. Short-term, however, low-carb, high-protein diets seem to be better. What is your experience here with weight loss and general health when it comes to diet? I mean, you have a lot of experience also with athletes. What do you do? How do you individualize? What kind of diets do you recommend? What is your experience?
So I tend to adapt, as you said, to the patient, habits and way of life, of course. But I must say that I've been more and more convinced that low carbs diet brings a lot of positive effect on health. It's not part of our training as a doctor. We were used to be learning that an equilibrated diet with the equal amount of all the elements is what we are supposed to eat. But in fact, if you go back to a very long time ago, let's say a million, when we were cavemen, and I think we still are in some ways, we have not been able to adapt to new type of food we're eating now. We're not using to eat so much carbs. Agriculture was not developed, and they barely eat any carbs in their regular life. They had some proteins and mainly vegetables, small fruits, bay. And so I strongly believe now that our body, our metabolism is not adapted to the food we have. And when you have a patient, particularly obese patient, and you start low carbs diet, it's so impressive how quickly they improve their health. You could see the complete profile of lipids, cholesterol, liver tests, and also on the ultrasound, you could find the fatty liver disappearing just starting for a few weeks, a low carb diet. They improve their stamina, they improve their physical activity and wellness. And so impressive and quickly, you cannot say that it's not existing. We just can observe. I'm using that very regularly in a controlled and medical way, of course. And if you speak about sportmen, we know now that a lot of sport tend to suggest low carbs diet for short distance exercising, quick and intense 100 meters run, for example. You can show that the sportsmen improve their health, athletes improve their health and their performance very quickly with low carbs. And also the long-term runner and all type of exercise over the months improve their health drastically with low carbs. So I've become, despite my training, a convinced low-carb diet doctor, I must say.
And what about the mindset? What does the mindset have? What kind of impact does the mindset have on general well-being? Because we know when we treat our patients, some people react very well and they improve and they get on their feet and they thrive. And others with another mindset might not. So your experience, Eric, on this, how important is mindset in improving and optimizing health?
So first, in my experience, when I have a patient sitting in front of me, after 5 minutes, I can tell what's going to happen, what we're going to find. You have those patients who are sporty, positive, happy, very active. They pay attention to their life and they socialize. They have good contact with others. And whatever you can say, they have a better health. They have less risk factors, and most of the time, I have not much to say. And you have those patients who are overwhelmed about the health situation, overwhelmed about their personal situation or the job. They are burnout, they don't have the time, they don't control the time, they don't have the control of their life. And those people tend to have worse health for sure. Practically, you know very well that behavior is the key for health. We know that genetic factors just play a very small role in health in general, probably less than 20 or 15%. Most of what happened to us is related to environment and to behavior. It entails smoking, alcohol consumption, the sleep quality, physical activity, diet, etc., etc. And a good equilibrium of everything is the key for a long life and a healthy life. And what is behind that? It's the mindset. If you have the right mindset, you can change behavior, you can adapt your life, and you can take the control of your life. So I think behind all behavior, you have the right mindset to have.
Mm-hmm. And the mindset and the behavior is, of course, also very, very much dependent on your social surrounding and your rapport with other people. As we know from the nurses study that was founded in 1976, which is the longest observational longitudinal study in the world, we clearly see over 40 years how incredibly important social interactions, friendships are for general health and for longevity as well. I mean, these are hard, there's hard evidence to show how important it is to interact. And this is, of course, particularly important now in these COVID times where we're isolated and we're home office and we don't interact as much. So this has a huge impact on mental health and the mindset in general. Yes.
And don't forget, where is the mind?
Yes.
All are believing it's somewhere up here because we have our eyes. The belly, as a belly doctor, I have to say, this is a second brain. And perhaps coming back to the microbiome, they are perhaps responsible, this little box, for your mindset even. And that's very exciting. We have seen that in some psychiatric illnesses, it depends what kind of box you have. And if you take a mouse that's very aggressive, take the stool, give it to the mouse that's peaceful, it changes. So perhaps
it's amazing.
It's amazing. And perhaps we can help that. We don't know if it's the egg or the chicken, what's first, but it's very interesting. And if I see the psychiatrist, doctors, how they are lost, I believe that's a very good setting for doing research.
Absolutely. There's so much still to learn, luckily as well. I mean, otherwise we might get bored as medical doctors and scientists. No, absolutely. Eric, you already talked a little bit about toxins and environment and that we always talk about nature or nurture, what's more important? Is it the genes or is it the lifestyle, nature or nurture? And what about environment and toxins? So you kind of very briefly discussed, for instance, alcohol. But what are there other kinds of environmental factors that really have an important role on general health?
So as you said, you have behavior that affects what's happening and also the environment. Among the environment, of course, we have to think about pollution, and we tend to underestimate the impact of pollution, and there has been increasing data showing how pollution is affecting your health, increasing the risk of lung disease, cardiovascular disease, cancer, and it's partly the case in dense urban area like in India, where the hope of life is lower and the length of life is lower because of the pollution. And then there are some factors that are not as well known. You have radiation. We are every day exposed to the radiation of the earth, radiation of the sun, and these are, of course, a big impact on our health. It's not so easy to avoid it. But if you live downstairs or in an underground area, you could expose yourself a lot to radiation without noticing it and increasing the risk of developing long-term health issue, of course. And then you have, toxin, metallic, like mercury, like lead that could be accumulated. If you just take this very simple question of the diet, if you eat big fishes, you tend to accumulate mercury and all the toxin, and these could have a very strong impact on your everyday health, on your psychology, or on your concentration, on your mood, and also on the risk of long-term cancer development. So we, for example, fish, we advise not to eat big fish more than once per month. And in some patients, in some culture, we tend to eat more of those fish now. We can measure this toxin on the blood.
Yeah. And what about rest and regeneration? Well, what can you say about that? I mean, sleep, the impact of sleep.
Yeah, sleep is so important. Sleep is so important. When I see patients every day, it's very rare to see a patient with a normal sleep. We tend to go very late to sleep. We've not been, despite the fact we know what's good to do, we don't do it. Since the electricity appeared a little bit more than 100 years ago, we tend to go later to bed and to dysregulate our natural rhythm. So we don't sleep enough hours. A very long time ago, we used to go early to bed, to wake up in the middle of the night to have something to eat and then have a second part of the night. Everything has changed now. And then you have all the disease that can happen during the sleep, like sleep apnea, like restless leg syndrome, like abnormal movement. All these elements can alter the quality of your sleep. And you have a lot of consequence from that we underestimate. The first one is that you feel very tired when you don't have a good quality of sleep. You don't perform very well. You tend to develop more depression and stress-related health issue. You live shorter. You can even see change in your DNA, not directly your DNA, but around your DNA. If you don't sleep enough, the impact are just major. You increase the risk of cancer. You can just have a car accident if you don't sleep well. So there's many impact on health. And so for me, it's one of the key elements of good health is to have enough sleep and a good quality of sleep.
Yeah. I mean, we see also, many people do not know that the toxins, the metabolites that we accumulate during the day in the brain, they have to be transported and broken down, and that's usually what happens during the night. And the same goes for the energy units that we use in the brain during the day. They are built, they are of course used during the day, and at night the reserves are very low. And those need to be built up as well, and that's what we do during the sleep. And that we can also measure, and which is really interesting actually to see. But when we now talk about nature versus nurture, or genes versus lifestyle, WHO estimates that in terms of cancers, 30 to 50% of all cancers, not all, but 30 to 50% can be avoided through right lifestyles and the right environment. Now, there, of course, that begs the question, what about screening? First of all, what can we do, and when should we screen? And particularly, of course, in colon cancers, we more and more start screening the people earlier on, depending on their family history and genetic background, on lifestyle and so forth. What can you say about the screening and the importance of screening in terms of cancers, particularly colon cancers?
I mean, it has been proven. The colon cancer risk has reduced tremendously since we have performed the screening. For example, in Switzerland we have a program, but we are still very much behind what we should do. A 50-year-old man has a risk 1 to 20 to develop a colon cancer, women besides as well. If you have in the family a first related mother or father, then the risk goes up to from 1 to 6. It's like a Russian roulette. And we have seen that now the developing is that the colon cancer starts earlier. So to prevent, you can either look at your stool and see if you have there blood, which is a method good for China if you have a big country where you have not the possibility to screen all of them. But if you can do an endoscopy, I can say this is the most important step to the future. Of course, we will not have in 10, 20 years the colonoscopy, because then we probably have developed a method to look in the stool if you have polyps. And the thing is, why you have this in the colon, it's so easy, because to develop cancer, you have adenoma, carcinoma sequence. So first is a polyp, and it develops into cancer in about 10 years' time.
So if you remove the polyp early enough, you will never have cancer,
yes,
or it won't develop into cancer.
And that's easier than in the lung or the breast. There are several, of course, organs you should check, but the colon is very important.
Yeah. And as an internist, Eric, what do you think about checkups? There has been quite a lot of scrutiny, particularly following a publication the Cochrane publication in 2012 that's criticized partially checkups. What can you say about that as an internist?
I tend to think that checkups are very positive and very useful. Of course, it depends on what do you mean by a checkup. We've known that for a long time. Doing full list of heavy exam like MRI or CT scan to the patient to tend to detect early disease or to prevent disease doesn't work. That we know for sure. It's very costly. It can induce a lot of stress and even induce disease. So the checkup is just not the question of doing a lot of exam to a patient. The checkup is to do the right thing to the right patient at the right time. That's been proven. We know that if we do the right screening to the right person with the right risk factor, we reduce disease, we reduce complication, we avoid a lot of problem. And a checkup is not just a list of exam or tests that you want to do to a patient. It's, at the first place, a long time you spend with the patient, much more than what you do when you see the patient on a consultation, regular consultation. When you do a checkup, you probably spend 1 hour with the patient, and you have plenty of time to discuss all the small details that he would not say otherwise. You will be able to discuss behavior. You will have to educate your patient at that time. You can detect side effect of medication. You can detect over-the-counter toxic medication that have been taken by the patient. There's an unlimited options of an opportunity to improve the patient health. So it's, for me, checkup is very important. It's not much developed in our Occidental society. It's not favored by the insurance or by the health system, and that's a shame, because you can do a lot of good things with the patient if you have the time to do it.
Mm-hmm. And during such a checkup, you can of course also investigate the family history and therefore also understand if there are any genetic predispositions that could also impact health, which we know, and it's very well proven that that is also the case, particularly in certain cancers, but also in heart disease and high cholesterol and in high blood pressure. And then, of course, so the question is really why you do it, when you do it, and how you do it. It's like a hip surgery. All hip surgeries are not of the same quality. It depends on the surgeon. It depends on the infrastructure. It depends on the nurses. It depends on everyone involved. And the same, of course, also goes for a checkup. You need the right place, the right quality, the right people, the right teams involved, and enough time allocated for it. So I fully agree with you. But I would also like to point out that we are not only talking about disease prevention and capturing disease early on. We're also talking about optimizing health, improving the quality of life, improving health, and reaching peak performance as well, as much as we can. And for that, checkups can also be extremely helpful when done in the right way and properly. So I would really like to conclude once again. General health is so important. In order to keep that, we need a healthy lifestyle, a healthy environment, but we also do need some support depending on risk factors and genetic predispositions. We might need screenings, and in the end, we might also need coaching and support to reduce risk factors and unhealthy lifestyles. And in the end, health is wealth. So thank you very, very much, both of you. It's been interesting, fascinating to talk to you today. So greetings from Zurich. Have a good evening. Thank you very much indeed.